My name is Dr. Amanda Ward and I'm a Melbourne-based obstetrician and gynaecologist. I have been a proud ambassador for Medical Mission Aid's partnership with the Murgwanza Hospital in remote, rural Tanzania for the past 18 years. But now I really need your help.
I first went to Murgwanza in 2007 as a medical student and was completely blown away by this place. It really does get under your skin. I remember seeing the poverty, seeing the patients that just desperately need access to the healthcare that we take for granted here in Australia, and you can't unsee that. And it really is important that they don't get left behind, and we need to step up to the plate to care for them.
Medical Mission Aid is an organisation whose vision is for a sustainable improvement in health outcomes in the most vulnerable communities in the most disadvantaged parts of the world.
Medical Mission Aid has been a supporter of this hospital for many, many years. We're there to support the local people, the local community, to ensure that we can actually effectively deliver a redevelopment together that will bring the hospital to standard.
And so over the last 18 months, we have been working with the health professionals in Murgwanza, looking at the plan, seeing where the deficiencies lie and what we can improve on, and really working with them to see what they need for their community. The Church Missionary Society in the 1930s started this little clinic, and gradually over the decades it became a hospital. It is supported in staffing by the Tanzanian government, but then in terms of infrastructure, it has no support at all.
This hospital is saving more than 80% of our community here. As a community, we are facing a lot of challenges in terms of health. This facility is here to serve life for many women, children. I think the hospital is something we are proud of, and we see it as a part of giving life to the community.
The hospital is about 250 beds, which is the biggest hospital in the whole area of 500,000 people. As a result, when there's a problem, the other hospitals send the patients to Murgwanza. It is seen as a bit of a light on the hill. It is really important that we continue for it to be a place where people can get the care they need and they don't have to travel the 6+ hours to another referral hospital to see the specialists that they need. With regards to the labour ward, they just don't have enough space to have a support person with them, which we know improves the health outcomes for the women. If there is an emergency, there really is limited space for which the staff can adequately treat the women, including a PPH or blood loss or neonatal resuscitation. There's just not the space and the facilities to be able to treat these adequately.
The hardest part of my job is when a patient comes and I know exactly what to do to the patient, but I cannot do because of lack of equipment. Her or his hope is on me, but I cannot even do anything because of lack of equipment.
The facilities are just crumbling. As a doctor, I walk in and think, how on earth can you provide adequate health care to save lives? To have one theatre and have to decide, do I do that caesarean section where that baby is acutely distressed, or do I fix that trauma patient that's bleeding out? I saw a woman develop a fungal infection that was completely life-threatening after childbirth, after a caesarean section, because we cannot keep the damp out of the theatres.
It was the state of the wards. I could see the need. They were receiving medical attention, but the hospital was crumbling around them. But those people deserve so much better.
A lot of the wards are quite dilapidated, the roofs are caving in, there is asbestos. This is where lives are at risk. They cannot be forgotten. It's so exciting to think of what we can achieve through this redevelopment.
This could be a once-in-a-lifetime opportunity to make lasting impact.
No woman, no baby deserves to die in childbirth, and we really need to put in those measures to stop it from happening right now.